talk about how to write systematic review. In this lecture, we will talk about the types of review questions, and these all are based on the Cochrane handbooks for systematic review. So, the types of review question, there are many types of review that questions that need to be implemented in our systematic review according to the which types of study we will discuss. First, we have the intervention review. The aim of the intervention review is to compare two or more intervention on a range of a different outcome. We have two or more intervention, and we have the range of different outcome, or compare a particular intervention with no intervention. Okay, so this will discuss the effect of the intervention on an outcome. The review question will therefore be along the lines of what is the value of intervention X compared with the intervention Y for a particular group of people, or what is the value of intervention X compared with no intervention. For example, what is the effectiveness, safety, and acceptability of surgery versus medical therapy for heavy mean central bleeding? This is an example of an intervention of two intervention on same outcome. Or we have another type of the intervention question is to ask whether to make intervention or not. Like in this example, can wearing compressing stocking compared to non-wearing them prevent deep vein thrombosis in people traveling in long-haul flight? So here we are comparing the compressive stocking wearing for some group of people with the other groups of people that are not wearing these compressive stocking. Diagnostic test accuracy review. This is the second type of a question where the diagnostic test accuracy review assess how well a diagnostic test performed to detect a particular disease. So we have many diagnostic tests that can be used to detect particular disease. Like, for example, for COVID-19, we have the PCR or we have the rapid test. Also in dentistry, maybe for measuring the accuracy of the root canal, we have the pixel-locator, we have a radiograph, we have CBCT. So we will test the accuracy of the diagnostic test. The review question is likely to ask how well can test X diagnose and detect disease Y. Okay, so how well can for example the X-ray diagnose and detect the effectiveness of root canal. For example, here, can a measurement of ferritin in serum or plasma be used to detect iron deficiency? Okay. The third type of review question, is a prognostic review. Prognostic review, from its name, so it will prognate the future outcome. Prognostic review assess the probable course or future outcome for people with a special health problem. This includes identifying important prognosis factor that might influence the course of the disease. Okay, so we have some course of disease or some outcome, and we want to prognose what will happen in the future. What will happen in the future for these people with that particular disease or particular health problem? We should prognose the outcome. For example, for a prognostic outcome, in people with this non-specific low back pain, what is the association between a personal expectation of recovery, include general outcome expectation, treatment expectation, and self-efficacy expectation measured in validated scale and disability outcome? Okay, so here we have the patient that are suffering from lower back pain, and we want to measure between the person expectation of recovery and the disability. So we have two future prognostic outcome that are maybe he will have expectation of recovery for the patient, including general outcome expectation, treatment expectation, self-efficacy expectation, and the disability outcome. The methodological review, this is another type of the systematic review question. Here, from its name, the methodological, it will address a question about how research is conducted and reported, include systematic review and primary studies such as randomized trial. So how are these research are conducted and reported? We will collect many studies and to see how these researches are conducted and report their methodology, the methodology that they are using for their study. Okay. For example, what is the impact of study design, including randomized control trial versus observational study design on estimated effect measure? On estimated effect measure. So we have to measure the study design on their measure, on estimated effect measure. The last type of question, we have a qualitative review. Qualitative review can synthesize evidence from sources such as interviews. So we have interviews, we can make evidence, synthesize evidence from it. And focus group to address a question other than effectiveness. Okay, such as how people experience an intervention or how an intervention can be put into practice. How can this intervention put into practice? How people expect on this intervention? How form of resources of the interview? Qualitative evidence can be incorporated into another review type, such as intervention review, or can be reviewed separately. An example of qualitative review is what are the barriers and facilities to the implementation of lay health worker programs to improve access to maternal and child health. Okay, so we will measure that this is a qualitative question because it is a question about what we have of facilities and what are the barriers that are in front of the implementation of lay health worker program to improve access to maternal and child health. Okay, and that part of a question, the type of a question. In addition to the type of a question, we have another type of a question, or two other category are the question may be narrow or broad review question. So apart from the type of there is issue whether the question need to be narrow or broad. So maybe you can ask a broadly question for a broad studies that answer a broad expectation, or a narrow question to a single specific area of outcome. So consider whether you wish to answer a narrow question, example looking at one specific intervention in a specific patient group, if you have just one specific intervention, or a broader question, example looking at all intervention to address a particular health condition or something more complex like health system or community intervention. Narrow question advantage. Narrower review are easier to conduct and easier to read, looking at one specific intervention at time, because it's just for one specific intervention, so it's easier to conduct and for the reader also easier to read. But their disadvantage are you may need to have multiple review to answer all the question or compare the treatment option relating to that condition. One way that Cochrane managed set of narrow review is to publish overview of reviews. So if we have many narrow question and we want to collect them into a more broader question, so we have something that is called overview that collect all the reviews and summarize the findings of them into a more broader answering of that question. Then we have the another type is the broader question, and the advantage of the broader question are more comprehensive and may look at a broader group of intervention or a wider population. A well-focused systematic review question will be broad enough to answer a useful question. This allows for some of the variation that will always be observed in a field. However, it must not be so broad that it doesn't make sense to consider all this study together into one review. So if the question is very broad, we may consider that we can split it into more than one review study. The disadvantage of the broad question is the answer of the question can be complex, more difficult for authors to conduct because it's answer a broad issue and a broader question. And for this, because if it's we are dealing with the author dealing with it as a broadly answer the question, so some of important details may be missed in the final outcome. And thank you.